It probably does help. Now, when I say help, it means that at least when you're taking the short term, it helps with things like inflammation and stiffness, so it helps with symptoms. There are some studies that show that if you take it over the long term, it might help to slow down or even stop wear and tear of the joints. So for the runners who have wear and tear, this might one of those things might help. Other things meaning things like if you might need to take anti-inflammatories and stop running if it's getting swollen, or at least modify your running. Every time you get an episode of inflammation and stiffness, you do lose some of the strength in the knee muscles, or rather the quadriceps, the hamstring muscles. You do need to rebuild them because when you run and you land, those are not only do they function as pistons, the muscles also function as your spring bars. If you become weak in them, then you get less impact absorption. Sometimes you might need to look at your running style, or even your alignment of limbs when you're running to try to minimize the impact. I sometimes get people who ask me whether if you don't have wear and tear already, whether you might take it as an insurance policy. And the most accurate answer I can think of is I don't know, because I don't know of any prophylactic studies that have been done. But the side effects of taking glucosamine is really quite low. So for some, if they want to take it as a kind of insurance policy, I really can't think of any good reasons to stop them from it. Just that you have to be realistic. In the end, it might not help. There have been studies to look at this, quite a bit into people that exercise a lot, and we do know that at least temporarily, especially after a long exhaustive training, it does suppress your immune system. Of course, it will return in a day or two unless you've been consistently overtraining, in which case you might be down for weeks. And sometimes people have tried to look at nutritional supplementation to see whether it affects the immune system or try to make it recover. The judge is still out there whether it helps. It probably helps if you have nutritional deficiency. Whereas if you take more than that, it might not really help.